Age-related macular degeneration is the leading cause of blindness in patients over the age of 60 in our country. There are two kinds of macular degeneration: dry macular degeneration and wet macular degeneration. The way to think about macular degeneration is a continuation of the same process. So macular degeneration starts off as dry in most patients and generally stays dry. In a small minority of patients, the dry macular degeneration can convert over to the wet form of macular degeneration. What this means is abnormal blood vessels can grow underneath the macula, which is the very center part of the retina. These blood vessels can cause bleeding, scar tissue, and eventually loss of vision. The key with wet macular degeneration is to pick up the problem right away and treat it before there's permanent loss of vision. Diabetic retinopathy is the leading cause of vision loss in the working age population in our country. The key thing to remember about diabetic eye disease is the longer you've had diabetes, the higher the chance of developing trouble in the back of the eyes. And diabetes causes trouble in the retina through a number of ways. Primarily, when you've had diabetes for many years, this results in damage to the small blood vessels in the back of our eyes. So when these blood vessels are damaged, the eye is not getting enough oxygen, and that leads through a series of events that can cause loss of vision. For example, you can get fluid buildup in the macula, which is the very center part of the retina. That can cause trouble with reading, driving, and normal activities. In addition, abnormal blood vessels can grow in the back of the eyes. These blood vessels can proliferate, they're very fragile, they can cause bleeding and scarring and even a detached retina, which can cause patients to go blind. The key with diabetic retinopathy is to watch your blood sugar. Controlling your blood sugar will reduce the risk of severe vision loss by more than 50%. Now, once you have the diabetic retinopathy, it's very important to see a retina specialist because we have excellent treatments now that can stabilize the vision and in many patients improve the vision. An epiretinal membrane is when a film of scar tissue grows over the surface of the macula. The macula is the very center part of the retina. So it's like saran wrap that's growing on the surface of the retina, and this can cause patients to notice their vision is blurred, straight lines can look wavy and distorted, they can have trouble with driving and normal activities. This change typically occurs because of aging changes in the back of the eyes. Many times an epiretinal membrane does not affect the vision, and in that scenario we monitor patients. But if the epiretinal membrane causes enough of a problem that the patient has noticing difficulty with their normal activities, then the epiretinal membrane can be fixed with a surgical procedure that's done in an outpatient setting. In the vast majority of patients, the procedure results in better vision. The macula is the very center part of the retina. It's the part we use when we look at people's faces, when we read, when we drive. Sometimes, because of aging changes, a break or a hole can form in the very center of the macula. This results in loss of vision and potentially a blind spot in the central vision. Fortunately, surgical intervention is very effective in fixing macular holes in most patients. In fact, the success rate for improving vision and closing macular holes is over 90%. The retina is the film in the back of the eye that allows us to see. Sometimes, because of aging changes or hereditary conditions or injuries to the eye, a tear can form in the retina. Once there's a tear, then fluid in the middle of the eye goes through the tear and it peels the retina off the wall of the eye, like wallpaper peeling off. This is called a detached retina. When someone is experiencing a detached retina, they would notice things like floaters, flashing lights, blurred vision, a shadow or a curtain coming down over your vision. If you notice those kinds of symptoms, you need to see a retina specialist as soon as possible. If the retina specialist examines your eyes and notices that there's a tear in the retina, we can fix that in the office with laser treatment. Once the retina is detached, this requires surgery in the operating room. Fortunately, Surgery for retinal detachments is extremely effective in restoring vision and fixing the detached retina.